Okay, both are surrounding the heart. What is the difference between the serous and the parietal?
It surrounds the visceral pericardium.
The parietal, or the pericardium surrounds the parietal surrounds the cavity, like the outer area, not the actual organ itself.
The cavity, not the organ. Okay, I get something important. So what I mean is not directly attached to the superior surface of the heart. This is what I mean.
So it's on the surface of the actual cavity, not the organ itself.
So my question is it or is it not directly regarding with the superior surface of the heart?
No,
Is
it's
my
not.
question.
No.
That's
No.
correct. I told you, you have to be clear with me. That's correct. So,
Can you repeat that?
huh?
Could you repeat what he said?
Yeah. So, the question is, the parietal pericardium is the layer of the serous pericardium that is not directly in contact with the heart. So, visceral pleura. See, who can answer? Come on. Okay.
It's the serous membrane surrounding the lung,
The serous membrane,
surrounding the lung.
the lung. But is directly attached with it or not?
Yes.
So, is the layer of the serous membrane that is directly attached, converted, surrounding the lung. So, pleura, parietal pleura. Come on.
It is the outer membrane that is not directly attached to the lungs. So
And
it's
it is attached to?
the lungs, or to the visceral pleura.
No, precisely. So, if
The
you come
cavity.
here,
The cavity.
come on, let me over here. Because they are recording here.
Yeah, I got a
No, no,
YouTube
it's okay,
channel,
it's okay.
so that way I'm
It's-
gonna
no,
send
I
it
don't
to
want
her.
to
Yeah.
everyone. I'm moving over here. So, look here. Those are the lungs, isn't it? So the serous membrane that is directly attached, follow the lung all the way. This is the visceral pleura.
Repeat that one more time.
Oh my goodness.
You just have
This
to-
isn't a book. Okay, wait a
You're
moment.
talking
Okay,
fast.
wait. This is not a lecture. I am not working like this. You have to start to learn how to work with me. Okay? We professors, we don't dictate. We explain, and you take a note. Understand? If you have any doubt, you can see the recording. Understand? You are university students. Okay? So, pay attention hardly and very carefully. That is the way. Because we cannot repeat 2-3 times the thing, because otherwise we are not going to finish. Because you're already working it. So, this is the pleura, this is the heart. The serous membrane that is directly attached to the heart, to the lung, this is the serous pleura. That's it. Like this is in your book, you can read it and confirm. Okay, what is the parietal pleura? Okay, the parietal pleura, if we get here out, let me see, in this side, the layer of the serous membrane that cover the inner surface of the thoracic cavity, this is the parietal pleura. So what does mean? It's not directly attached to the lungs. Are we there?
Yep.
Good. Any question? Let's continue. Visceral peritoneum. Who can answer? Come on.
The serosal membrane that directly attaches to the abdominopelvic organs.
Correct. That is the point. Is the layer of serous membrane that is directly attached to investing the different organs of the abdominal and pelvic cavity. Correct. Congrats. So, what is the parietal peritoneum? Okay, come on.
Is it not directly attached to serous membrane around the lining of the abdominal cavity?
Correct. So it's a layer of the serous membrane that line the inner surface of the abdominal cavity. So that what is parietal? It's going to form in the wall. Any question regarding with this? So now, very simple. If somebody asks you, what is the pericardium? What should be the answer?
Serous membrane surrounding the heart.
Surrounding the heart. It's the serous membrane that is surrounding the heart. What is the plural?
Serous membrane surrounding the lungs.
The lung. What is the peritoneum?
Serous membrane surrounding the stomach, the
The
abdominal
abdominal
cavity.
cavity. That's correct. So for each of these, we are going to get. Do you have a pen?
I ain't asked you no questions.
I have my hands the rest
So, let me explain only one quickly. This is the heart. Over here. So this is the heart. And here we are representing the aorta with ascending the arch and descending part. So in round, we representing one pericardium. It doesn't make any difference, but anyway. See? This is one pericardium. This is the fibrous. And internally, we have, does it allow you to see?
Oh, thanks.
And internally, we have the serous pericardium. This is the fibers, and this is the serous. So in blue, let's see what it is. We have a serous pericardium cover the external surface of the plasma. See, red. This is the serous membrane of the pericardium cover the inner surface of the fibrous pericardium all the way, and when they come here to the root of the great vessels, they come to reflect one into another. And then we have another layer that is going to be covered directly the superior surface or the superior surface of the heart. Yeah. This one that cover the superior surface of the heart at this point, it continues one to another. Can you see now? So now we get that the pericardium possesses two layers. The fibrous pericardium externally, as the name says, a fibrous membrane, and internally we have the serous pericardium. And then the serous pericardium possesses two layers. In green, the visceral layer, and in red, the parietal layer. So that's why the parietal layer is not directly regarded with the superior surface of the heart, but the viscera is. It is. And both the green viscera and the red parietal, they reflect at the root of the great vessels. Here I only represent the aorta. Also, the pulmonary trunk, the superior vena cava, the pulmonary veins are there. So what does mean? That the space between the visceral layer and the parietal layer of the serous pericardium, this space here, let me fill it with blue. This is the parietal, this is the pericardial cavity. And there is a small amount of serous fluid that allows the smooth movement when the heart contracts. When this fluid is not enough and it's becoming lower, then we start to hear some sounds. So if there is too much fluid, okay, now there is an infection, it's a pericarditis. If there is a trauma with the broken ribs that pierce the pericardium and start to bleed inside, the blood starts to be accumulated there, so we are in front of the hemopericardium. It is hemo because it's blood, pericardium continue growing, and it tends is going to limit the movement of the heart. And then we go to the top of the heart, a completely block of the heart. So that's all, some of the clinical manifestation and clinical correlation of the pericardium. Are we there?
Yes.
The rest, what I explained the pericardium, because it's the only one who possesses fibers and viscera. The peritoneum is two layers, the visceral layer and the parietal layer. What is the most confusing part is the cavity, but this is just generally, you are going to get into detail when you go to anatomy 2. Okay? Any question? Down with this. You got it, making it up?
Yes.
Okay, let's continue quickly. Okay. Let's go on the page. So the next one. So this is much each of the following discussion with the key. Equivalent with the record of the key. Okay, who could answer the first one? Come on.
Buccal.
Okay.
Buckle.
So, but read completely.
Oh, so cheek
Okay.
is referred to as buckle.
To the buccal. Okay, correct. So the cheese is referring to the buccal. Is mouth. Okay, number 2.
The digits are pertaining to the fingers.
Digits are referring to the fingers. Correct. Number 3. Who can answer?
Scapular.
Scapular, shoulder blade region.
The scapula is regarded with the shoulder girdle region. That's correct. Number 4.
Patellar.
Is the anterior aspect of the knee.
Okay. Anterior upper of the knee. What do you call?
Patellar.
Patella. That's correct. 5.
Calcaneal. referred to
Calcaneal is related with the
The heel of the foot.
That's correct. And 6.
Cephalad.
Pertaining to the head? Cephalic. Good. Any question? Doubt? Everybody there? So if somebody doesn't fill out or didn't have time to finish, that's the time. That's why we are coming over it. Good. Questions? No? So we continue. Number 2. So A. Who would like to answer?
Okay. Oral.
A is abdominal. How do you answer?
Okay.
K.
What?
Oh,
Human base?
no, because we need to.
Should we just go? Should we just go from top to bottom on the
Yeah.
anterior side?
So it has to be done with this. Okay. So here is referring to this area. What should be?
Oral.
Okay, oral.
Oral. That's correct. The next indicator is at this area.
Cervical.
Cervical. The next one should be with the
Thoracic.
The other is abdominal. The other is in the center. We don't have anterior wall.
Umbilical.
Umbilical region. That's correct. The other one, let me use myself, is at this level.
Antecubital.
Or cubital fossa is the area. So the other is at this area.
Pubic.
Pubic. The other is at the
Femoral.
femoral. The other is
Fibular.
fibula. The other lateral.
Is
Crural.
crural.
Posteriorly, we get
Occipital.
occipital. We get approximately at this area.
Lumbar.
Lumbar. At this area.
Gluteal.
Gluteal. Posterior to the elbow, to the knee joint.
Popliteal.
Popliteal area. And in the calf.
Sural.
Sura. That's correct. And also, remaining there, this area over here.
Brachial.
Brachia. Good. At the different area of the body. So, classify. Let me bring the skeleton.
Y'all having fun yet?
At least I'm not sweating.
Like, already.
No, I'm
I
sweating.
know, me too. It's fine.
Here we are.
I still feel like sausage casing.
So, here, go down. So we are asking, so if I am referring to this, how do you classify?
Appendicular.
Appendicular. And this?
Appendicular.
And this?
Axial.
This?
Axial.
This?
Axial.
This?
Appendicular.
Correct. So everything that is in the midline corresponds with the axial skeleton. The axial skeleton is composed by the skull, the vertebral column, and
The
the
thoracic.
thoracic bones. It means the ribs with the sternum. Everything related with the arms and the legs is the appendicular skeleton. So remember, we have the shoulder girder, we have the arm, forearm, and hands. In the lower limb, we have the pelvis girder, the thigh, the leg, and the foot. Questions? Doubt? Continue. So body orientation, direction, plane, sections. Describe. So,
May I?
yes please.
It's the body in an upright position with slightly apart lower limbs, feet flat on the floor facing forward, limbs at sides with the palms forward, thumbs away from the body, and head and eyes looking ahead and straight.
So, who can come and show me here what is the anatomical position? Come on. Let's move here. So, this is the anatomical position, correct? So, the eyes into the horizontal line. The arm, the palm of the arm faces anterior in hypersupination. Arms resting side by side. Foot approximately together, faces anterior. This is the anatomical position. Thank you. Great. So, what is important in the anatomical position? What do we need to know the anatomical position? Okay, come on.
It's a reference for when you're describing the body parts or directional terms for anatomy.
Correct. It's the way that we, all of us, those who are related with anatomy, in order to be oriented and talking with the same position, with the same reference point. Okay? Good. Okay, let's continue. Any questions? Those who are at home, this is printed there. I can give you when you all come back. Unfortunately, I don't have the digital version. If any of you can convert it to digital, great. So, number 5. What is sections? Who can tell me?
There's slices that can be longitudinal, transverse, or oblique.
Correct. Sections are the cuts that we perform follow some guidelines. What are those guidelines that we use in order to perform a section? What do we use in order to perform a
Planes.
section? Planes. That's correct. So something is when you perform the cut, the section, and the other, how do you guide yourself in order to perform that? What are those tools that help us to perform the section are the planes? So, what is the definition of plane? Come on, who can tell me?
The plane is an imaginary line that separates the body into two separate parts.
Okay, that's I made in dying. Correct. They're going to perform the orientation. So, basically in it, we have to orient the plane. So, but before to get there, let's answer 6. Come on. Number 1.
Anterior.
Anterior. So, but please read completely in order to get the sense. Who would like to answer?
In the anatomical position, the face and palms are on the anterior body surface.
Correct. That is correct. Okay. Who continue?
The buttocks and shoulder blades are on the posterior body surface.
On the posterior body surface. Come on.
And the top of the head is the most superior part of the body.
The more superior part of the body. Correct. Who would come next?
The ears are medial and superior of the shoulders and lateral of the nose.
And lateral to the nose. That's correct. Who come? Come on, please.
The heart is anterior to the vertebral column and medial to the lungs.
Correct. Finally, you get it. Come on. The elbow. Who would like? Come on, please.
The elbow is proximal to the fingers, but distal to the shoulder.
The elbow is proximal to
The fingers,
the finger and
distal to the shoulder.
correct, because It's comparison. So, what is the reference point? The elbow. How, when you compare the elbow regarded with the finger, how is the elbow regarded with the finger? It's proximal, nearby the
Center.
line,
Yeah.
nearby the trunk. But when you compare the elbow regarded with the shoulder, how is the elbow regarded with the shoulder? Distal, because the shoulder is proximal. You got it?
Yes.
Good. Let's continue. Who else? Come on, those who are not participating, come on. Everybody has to participate.
The abdominopelvic cavity is inferior to the thoracic cavity
Correct? And?
and anterior to the spinal cavity.
Correct. That's correct. We'll continue.
In humans, the dorsal surface can also be called the posterior surface.
That's
However, in quadrupeds, animals, the dorsal surface is the superior.
correct. Is the superior. That's correct. It's the responsible because remember we are bipedal. So everything posterior is dorsal. But if you go to the quadrupeds, the dorsal goes up. Okay, do we finish?
If an incision cuts the heart into right and left parts, the section is a sagittal section.
Good. Next.
But if the heart is cut so that the superior and inferior portions result, the section is a transverse section.
The transverse section. That's correct. Any else?
You were told to cut a dissection animal along two planes so that both kidneys are observable in each section. The two sections that will always meet this requirement are the transverse and frontal planes.
In order
Or
to get
sections.
kidney. So the transverse and the frontal. Everybody's agree?
Yes.
That's correct. Look here. So if I remove the liver, the stomach, and now the intestine, so we can see the kidney. You see? You too? The two kidneys. Everybody see. So, in order to see the kidney in all sections, first, if I am performing this section, what is this section?
Transverse.
Do I see both kidneys?
Yes.
If I am performing this section,
Frontal.
frontal, like this one, do I see the kidneys?
Yes.
Yes. So if I perform the sagittal, do I see the both kidneys?
No.
So that is the correct answer. Everybody there?
Yes, sir.
Good. Okay. What else remaining?
A section, oh, go ahead.
Come on.
A section that demonstrates the continuity between the spinal and cranial cavities is called a sagittal section.
Correct. In order to see the cranial and the vertebral cavity, you have to see in sagittal section. Okay? So, for instance, we go to we go here. And you see? This is the section we wanted to see the cranial and the cranial cavity and the vertebral cavity. So remember, cranial cavity and vertebra, this is posterior, this is anterior. These two are the posterior cavities, and these three, or these two, are the anterior cavities, thoracic and abdominal. Remember, later the abdominal cavity is divided into the pelvic and abdominal cavity itself. Okay? Good. Let's continue. What else remaining? We finish? Okay, now 7, 8,
Sagittal.
sagittal. If you see 7, that is this picture here, this is represented the sagittal. So what is the plane? From now on, the plane is this. Let's take it as this paper. This sheet of paper is a plane. If I orient it like this is a sagittal plane. If I perform the section, it is a sagittal section. So what does mean? This is parallel to the sagittal suture. Let me put it here. What is that? All of you can see? That's what I need. So can you see? Oh, this is this one. No, which one can I need? Okay. Here we are. This is the superior view of the skull. This is the frontal bone, this is the occipital, and these two are the parietal. Okay? Frontal, the two parietal, and this is the occipital. This suture here is the sagittal suture. This is the frontal, and this is the lambdoid. So any plane that you oriented parallel to the sagittal suture, any plane that you oriented parallel to the sagittal suture, what is this?
Medial.
The sagittal plane.
Plane.
Is the sagittal plane coincides exactly millimetrically on the midpoint, mid-sagittal point. This is the mid-sagittal plane. If we perform a section at this level, we are going to have an identical measuring half. But in real time, it never happens. Unless that you have a millimetric computerized section. Okay? So what I would like to tell you is that this plane is a sagittal plane. Why do we call it sagittal? Because it's parallel to the sagittal suture and perpendicular to the floor. If I orient it like this, what should be this plane?
Frontal.
Frontal. So what is frontal? Because it's parallel to the frontal suture and it's perpendicular
To the
the
side.
floor.
Not to the front.
Okay? Then, what is the other plane that we have?
Transverse.
Transverse. So transverse is any plane, as I explained before. This is the body. This is the longitudinal axis. Any plane that's going to be in 90 degree in a straight angle, this is a transverse plane. It doesn't matter which level, as far as they maintain this 90 degree. Over here is transverse, transverse, transverse. But if this plane is not in 90 degree, is any other degree out of 90, how is this plane? Oblique. You got it now? Now you get the definition. What is the axis, longitudinal axis of the body, the transverse plane.
Yep.
And any plane out of this 90 degree is oblique. From up to down, right to left, or vice versa, from up to down, left to right, or from down to up, whatever. Question? Doubt? Good. So far we are going well. Okay, so now result. What should be the result in sagittal section? What do we obtain after perform the section?
Right, left.
Right and left portion. In frontal,
Front and back.
anterior and posterior.
Posterior.
In transverse,
Superior, inferior.
superior and inferior. Okay? Good. Okay, let's continue where we are. Now, 9, 8. This is the kidney to draw in section. Come on, show me what you did. Let me see.
You can,
Let me see. Yeah, but it's not exactly what he was asking. No. You didn't do it? No. Let me see. That's correct. That's correct. Oh my goodness. It was almost there.
No.
Oh, my goodness. No.
no, no.
No. This is not what was required. Yes, that's correct. That's not. And it
What
was
it looks like after.
half half. No. That's correct. That's correct. And
Not the best artist.
yeah, no, no. That's it's correct. That is correct. Oh, only one. My goodness. So, no, it wasn't. So, only remaining you.
What did he say for yours?
No.
Nah.
So,
I need to buy some
what they are
pencils.
asking you, very simple. So, they are asking you to represent the kidney in the section in order that you can see. If you see the position of the kidney, so this one, in which section is this one?
That would be a frontal.
Frontal. So in frontal section, what you are going to see is the beans shape of the kidney with the suprarenal, if you want it, and the pelvis, but what you are going to represent is the kidney pyramid. That's it. With, if you have a little bit more, you can get the minor calyces and the greater calyces and the pelvis. That's it. Okay? So, if we are going to represent that in transverse section, what you are going to see? Okay, we cut it over here. You are going to see the kidney with the hilum. And that's why you represented, she represented, he represented, all those things. You are going to see again the pyramid. Maybe you don't know the pyramid, but it is the position. Okay? Frontal, transverse. Now, sagittal. What you're going to see is sagittal. This is the frontal, this is the transverse, this is the sagittal. If you perform the sagittal section here, as you see, so what you're going to see is something like this on the kidney, because you are going to cut it all the way. When you can see part of the ileum and the representation of transverse part of the pyramid. Understand? Schematically, what you did is a schematic representation. It's not so bad. I am glad that you did that because all of you were oriented. But it was what was asking. Understand?
Yes, sir.
Good. Let's continue. 9. Okay. So we are talking about the different segment. So I don't have the. Not yet. You have to remain in your room until the time comes. This is the rules of the university. They want to invade your room. No, it's not the time. The time comes at 12.
Right.
So, okay. Abdominal. Let's do it quickly. Let me represent it here. If we perform, this is the synthesis. This is the typhoid process. These are the crest. These are the nipple. We perform the section. And we have the different. We have 1, 2, 3, 4, 5, 6, 7, 8, and 9. So, what is 5?
Umbilical.
region.
The umbilical region. Another name. Another name.
Belly button.
Hmm?
Stomach.
Another name. Mesogastrium. Number 1.
Epigastric.
Epigastrium. Epi because it's above. Above what? Gastrium, what means? Stomach. above of the stomach. Epigastrium. Meso.
And below is hypo.
Gastrium. No, this is the umbilical region.
Yeah, but. below-
Umbilical or mesogastrium. And now, if you're coming for epi, meso, what should be this one?
Hypo.
Hypogastrium. Do you got it?
Yes.
Correct.
So, what is two?
That's the right, no, sorry, the
Left
left hypochondrium.
hypochondrium.
Oh, anatomical position. Okay. So this is the left hypochondrial region. Okay. Why do we call it hypochondrium?
Because it's below the ribs.
Below the ribs. And the ribs are formed by cartilage. If what is the term? The Latin term for cartilage? Chondrium. Chondrium, cartilage. The word is hypochondrium, beneath the cartilage.
Or the perichondrium, the part that surrounds the cartilage.
No, the perichondrium is the membrane that's going to cover completely the external the cartilage. No, it's for the term,
The chondrium is
the
one.
chondrium,
It's cartilage.
cartilage. That's correct. The left. And this one,
Right
right what?
hypochondrium.
Hypochondrium. 6.
The left lumbar.
Left lumbar. What another term for lumbar? Any another? Flank. Flank. The left and right flank or lumbar. So, 7.
Right flank. Oh, hold on. Oh, sorry.
Left,
Left.
Left
iliac.
iliac or
Inguinal.
inguinal. And this 9,
Right iliac.
right iliac fossa or right inguinal fossa. Okay? So how to perform those sections, those imaginary lines? The 2 vertical lines pass through the nipples all the way down, and the 2 horizontal one is at the inferior border of the chondral cartilage, and the other is at the superior border of the iliac crest. Those are the reference points or landmark to perform those sections. And this is very important because this is the division in 9 spaces or quadrants of the anterior abdominal wall. Okay? Anterior abdominal wall, not the division of the abdomen. And why is this important? Because you are going to see the projection of the different viscera in those areas. For instance, let me do it quickly. We started here with the esophagus, then with the stomach, then the duodenum, then the small intestine, ilio, gastric fossa, ileocolic, the second, appendix, ascending colon, transverse colon, descending colon, sigmoid colon, rectus, and anus. But if you want to add more, you go here to the spleen, then the pancreas, the head, the body, and the tail. Then you get here the right big lobe of the liver and the left. Here you get the kidney with urethra. The urethra, urinary bladder, and urethra. With the supercussions, we can get female reproductive with the clitoris, the ovary, and so on. Understand what is the meaning of this? This is important to see the projection of the anterior abdominal wall of the different viscera of the abdomen. Are we clear?
Yes, sir.
Good. Next, clear up?
Yes.
Good. You are doing well. So, something else remaining there, please? Everything was done? So, cavities. So, 10, come on.
Surgery to remove a cancerous lung lobe in the thoracic cavity.
Good. The 2,
Removal of the uterus or womb, abdominal pelvic.
abdominal pelvis.
Removal of a brain tumor, which would be B, cranial.
Cranial. Appendectomy, number 4.
Abdominal pelvic.
Abdominal pelvic. Can you see? In that right ear. Stomach also operation,
Abdominal pelvic.
abdominal pelvis. Either the epigastric or the meso. Number 6,
Delivery of preoperative saddle anesthesia, spinal.
is spinal. That's correct. Everybody answer properly? Let's continue. 11,
The muscle that subdivides the ventral body cavity, the diaphragm.
the diaphragm. That's correct. 12,
The integumentary system would not be represented in any of the body cavities.
okay, because it's a skin plus the special sense. So when we talk about the skin, we say this is a skin, but a skin with the receptor plus the glands plus the pironectar muscle. All this is the integumentary system,
Largest body, largest organ.
organ of the body. So this is very important. So in order to preserve your skin, the more important thing is water. Keep your body hydrated properly. Drink water. No soft drinks. Water. please. Water. I am against of the soft drink. I didn't say I didn't drink when it's necessary. I didn't say that. So what are those artificial soft drinks? What do they have?
Everything.
Sugar, that's it. Nothing else. What those energetic beverages, what do they have? You don't even know. You don't even know. Right now, do you know if there is a cancerous element or agent? You don't know. And you see those people drinking. When you get into the biochemistry, you will see with Dr. Bracho that you don't need any special energy. You only need to take care of your body properly. It means good nutrition, good health, and elements. So, up to here are the times. So please keep continue checking these, answer all of them because its time is over. And if you have any doubt, bring it to the next class.
Okay.
Thank you very much for your time. Yes, please.